Here we go. Hello, everybody. Welcome to the Nurse Susan podcast. Today, I have a lovely couple who I met at a conference for nurses in business. I'd like to welcome Shelene and Brent Giles. Hello. Shelene has her own nursing business, which I want her to, share with everybody as well. But the reason why I have them on the podcast is because when I met them at the conference, they were exhibitors at the conference, and I was just going around to the exhibiting tables. And I told them that I am a cannabis nurse, and they shared their incredible story about how cannabis helped to heal Brent's chest wound from multiple surgical procedures. So welcome, Shelene. Welcome, Brent. And so happy to have you here.
Thank you, Susan. We appreciate it. If it's okay with Brent, I'm going to tell his story, and I think he prefers it.
Yep.
He prefers it that way. So it was literally 3 years ago, almost to the date, that he ended up with 5 emergency cardiac bypasses. We were totally oblivious to any underlying cardiac condition that he had. The doctor said that he was literally hours to days away from dropping dead of a heart attack. We had no clue. It was just by the grace of God that brought him into the ER. They checked his heart. And then the next thing we know, he's in a heart tower hospital undergoing 5 bypasses. The doctors had said that 1/3 of his heart was not viable. And basically the main artery was 90% blocked. All other arteries, primary arteries, were 100% blocked. He did great through the cardiac bypass. Spent a week in the hospital and was discharged home. Just kind of a little bit of a caveat. He does have pre-existing diabetes, but he's young and in shape and looked really, really healthy. So we think that the way he looked, the hospital staff overlooked some red flags that were coming up, meaning some infection. So the day that he was discharged home from the hospital, he started acting different. Never ran a fever, but all these other signs and symptoms. And the short story is that staph infection was not diagnosed in a proper time. And so he was literally eaten up with staph infection all the way in through the bone. In the sternum, into his pec muscles, most of his anatomy here, and in his back and in his shoulders. He was in and out of the hospital for 10 months with staph infection, and then also because of cross-contamination, E. coli, and ended up not only with the 5 bypasses, but 14 irrigation and debridement surgeries, and another graft because they broke one of the bypass grafts during an irrigation and debridement. So he had 2 open heart surgeries, wound vacs. He also fell and broke his leg in the middle of all of this, excruciating pain between breaking the leg and an infection. And after 10 months, he was literally left with a hole in his chest the size of a football. And they could not get the pain and the infection under control. He had IV antibiotics that would put his white blood cell count to 0, into kidney failure and into liver failure. So we were just fighting an uphill battle for about 10 months. Somewhere in the middle of all of that, you kind of have this come to Jesus moment where you just say, God, I give it to you. We give it to you. We have been holistic kind of people from a naturopath perspective, medicine, things like that. We had heard about THC from others, but not really from a pain perspective or an infection perspective, just more of a feel-good perspective. And started reading up, and it literally was one day that we were waiting in the doctor's office, and he was giving up on life. I mean, he just basically said, I don't think I'm going to live through this. And I literally went across the street to a naturopath pharmacist and just walked in and said, I need your help. Because we were at our wits' end, and we felt like the traditional medicine was beginning to give up on him. He was just kind of a lost cause.
And the 4 other men.
And yeah, the other thing was he was one of 5 who got staph infection. He was the only one that lived. The other 4 patients on the same floor passed.
Close to my age.
Oh my God.
So we just felt helpless and hopeless. Me being in the medical field, that really, really hit home. So we were literally leaving the doctor's office, and there was a naturopath pharmacist across the street. I walked in and said, do you have 5 minutes? An hour later, we walked out with this naturopath saying, THC, CBD helps with pain, helps with inflammation, helps with infection. Where we lived wasn't available readily, so we did get a hold of some, and within a matter of 30 days, there was improvement after 10 months. Within 30 days of using THC and CBD, a combination, massive amounts, we started seeing an improvement and started managing his pain. And we told the doctors, who did not believe us. And
they didn't like it.
No, they did not like it. And we continued on. We continued on, and it took about 2 years. So like I said, 3 years almost to the date this week. It's been 3 years. And so it took about 2 years to get things under control, and finally enough to where all the infection was under control, where they could actually reconstruct his chest. And his recovery went extremely well after that because of the use of the THC and the CBD. So we used it for pain management. We used it for inflammation in the body, and we also used it for infection control.
Well, we also used it for sleep.
Sleep was a huge issue.
I couldn't sleep because all the medicines, and taking that helped me rest through the whole night.
Mm-hmm. Yeah.
And that's so important when you're trying to heal.
Yes, healing was a huge issue. So now we're kind of on a maintenance program. Sleep is still, I wouldn't say an issue, but we do use it quite a bit for sleep, because a lot of the infection ate a lot of his muscle, his tissue and bone. And so chronic pain is an issue. He is not cleared for any surgeries, and so what would be repaired in surgery he can't have. So we use it at night primarily for sleep, and then flare-ups, every now and then flare-ups.
Yep.
What do you mean by flare-ups?
Flare-ups of pain, like if he does something a little bit too much, or something's going on stress-wise. Stress will flare up his symptoms. And so we'll use it regularly at night for a good night's sleep, and then anything for flare-ups and pain.
Mm-hmm.
So that's what we've been doing. Mm-hmm.
Wow, what a story. I mean, you just told me the tip of the iceberg when we were at the conference. This goes way beyond.
It does.
Way beyond. It's really...
It was a lifesaver. He was able to get off all pain medicines, which were also causing a lot of side effects. The antibiotics put him into kidney failure and liver failure and zeroed out his white blood cells. So immune deficiency was a huge issue there. And so by using this, we were actually able to use less antibiotics. and eventually get off those as well. And so with the exception of diabetes and heart medicines, he's off all other medicines that they were prescribing regularly.
Oh my God. I
Mhm.
mean, just being able to get off of opioids. I mean, there's so many people who are stuck on opioids and they don't realize that cannabis is a wonderful alternative to that.
Yep.
But if we were to back up a little bit, I want to kind of get down into the weeds a little bit. Now, before you answer this question, I want everybody to understand that dosing cannabis is a very individual thing. So I'm going to be asking about your doses, how you took it, was it topical, was it by mouth, etc. But this is not giving medical advice to anybody. If you have a medical issue that it responds well to cannabis, it's very important to seek out a healthcare professional. There are nurses out there who specialize in cannabis and can help you through this, similar to what Shelene and Brent did in finding a naturopathic pharmacist. So let's back up a little bit. So, what was the advice that you originally got from the pharmacist in terms of your dosage, the method of administration? Did he put you on an accelerated dosing regimen? Tell me more about the granular part of that.
Sure. In the beginning, while we were researching for resources, we started out with CBD and we started out with liquid in the mouth. And I don't remember the exact dose, but what the pharmacist said is you need 10 times the amount that was on the bottle. And the nice thing is you can't OD on this. You're not going to overdose on it. So that was my recall, was we were doing, and he said 10 times the amount of the dose, and then whatever the frequency is, double that. So I think we were doing, I can't remember how much, but it was 10 times the dose with the dropper, literally like every 2 hours, and then went every 4 hours. And we did this for several months. And then when we were able to get a hold of some cannabis, we actually started with the vaping. And that did not work well because he also had a collapsed lung. And he had chest tubes and drain tubes. And so taking deep breaths and then coughing was not good. So we ended up.
Plus, I'm not a smoker of anything. So it's anything going in that way just makes me start coughing instantly.
So we discovered edibles, we discovered gummies. Some wonderful friends of ours actually made like a butter, like a paste that you could actually put in coffee, put on foods and things like that. And so that was a little bit stronger. But we ultimately settled with the liquid CBD and then edible gummies, THC, CBD. And those gummies, I think we started out around 20 or 25 milligrams. It was a higher dose, and now we're down to the 10 milligrams. Doesn't do any vaping. And then the other thing that we discovered was like the roll-on, the topical. And so we use the topical now for like joints, particularly the upper body, and then some stuff going on in the spine. So now it's the edibles, the gummies, 10 milligrams. It's like THC, CBD, and CBN, a combination for sleep at night, and then the THC, CBD roll-on topical for areas. So that's what we're doing now.
Wow, that's incredible. You know, it just shows the power of cannabis, because when you describe those doses, those are pretty reasonable doses. You know, when I work with cannabis patients, we're using a gram, which is 1,000 milligrams. So it's a huge dose, but it's also kills cancer and saves lives. So just knowing that there's such a range in the dosage of cannabis to give you a variety of different effects just kind of, is testament to the power of this plant. And like you were saying, you can't overdose. You can't have a fatal overdose. If you take too much THC, trust me, you are going to be very uncomfortable for a few hours and you will never take that much again. So it'll only happen once and you'll never forget it because it's very uncomfortable. But you never have to worry about a fatal overdose. You don't have to worry about any addiction. You don't have to worry about so many things that come along with antibiotics, with pain medications, with sleep medications, for all of those things. So,
yeah, I would say we average about $25 to $45 a month. So it's very budget friendly. So I wanted to let folks know that we're not breaking the bank on his maintenance program at all.
Now my other meds are.
Oh yeah.
Yeah. The pharmaceutical industry is making sure they get their cut, right?
That's true.
Oh boy. Wow.
Get it before the pharmaceutical companies get a hold to it.
Yeah. That is a big concern in the industry, and we could get into the weeds on that, and I could get on my high horse and on my pedestal and start preaching, but I'll spare you all of that. But I completely agree. I think it needs to stay in the hands of the people, of the users, not have an intermediary who is going to dictate who can have it, when they can have it, how much they can have, etc. So yeah, I totally agree with you on that one. So so in terms of the emotional impact that this had, in my own story, with a neurological movement disorder that just gets worse over time, it got to the point in that progression, which is when I went looking for something other than the anticonvulsants that I was taking. I was pretty desperate. I was getting depressed. I was becoming isolated because I was shaking so much. People would look at me like I was a drug addict or something. And I couldn't do the things that I normally had been able to do. I had, left patient care years before, but, it got to the point where I couldn't drink out of a glass. I couldn't button my buttons. It was like just activities of daily living I became dependent on my husband for, which is psychologically, it really is traumatic to experience that. And I was in my 50s and 60s. So anyway, that was one of the aspects that made me so grateful for cannabis, that there was an alternative, a very effective alternative, and it brought so much hope. And instead of looking at my future like, oh my God, it's just going to get worse from here, to thank God I found this, it's getting better. Can you kind of describe what your experience was like in that regard? It must have been very scary for you, Shelene. I know that watching somebody who you love dearly go through something like this, and being a healthcare provider and knowing too much information, it can be very difficult. So can you get into that a little bit?
Sure. Like I said, this just came out of the blue. All of the cardiac issues were just, out of the absolute blue. We kept on saying, you have the wrong person. They literally did repeat all of the cardiac studies and said, nope, it's that bad. So that was an emotional trauma there for him and for me. And we were in our 50s, and so we weren't planning this life event.
56 for me.
Yeah, he was 56 at the time. And so then in and out of the hospital and not being heard by the medical staff, both of us, for so long, to the point where he was literally near death. His ejection fraction had gone down to 5%, which, if anybody knows, usually folks don't live at that point. So there was a lot of emotional trauma that we suppressed for a long time just to focus on his health. And when he started stabilizing, we both realized the anxiety, the PTSD, the depression, all of these emotions, psychological stuff coming to the forefront. And what was suggested? Take a pill. And tried that and had more side effects. And so we also used the CBD and the cannabis for emotional support as well. And, you know, all of the emotion is the emotional baggage is not gone. He gets physically sick going to the doctor's office because I truly believe it's PTSD. Certain smells, certain colors, certain things just really trigger the emotions, but it's better. It's a lot better to be able to bring that anxiety down. We actually did go to have his brain evaluated because of some neurocognitive deficits, some memory loss, stamina, some interchanging numbers, things like that. And what the specialist said was, your brain is in constant fight or flight syndrome because of all of the trauma you were exposed to, and you literally had to fight for your life. And so we are using the cannabis and for helping the emotional side of things. So I think we're working on that now. And it's helped. Best way I can describe it is take the edge off so you can deal with things. And manage, but
it's stressful being in how many surgeries? 16
surgeries in 10 months.
Oh my God.
Yeah.
That's crazy. Oh, I'm so sorry you guys had to go through that. You know, you go from having
I just laid there. She went through everything.
My husband's like you. He's like, tell her, let her, you know. That's so funny. Yeah, you guys, you have been through the mill. And, you know, the reason why I do this podcast is not only for nurses to understand that cannabis is a legitimate and very effective, powerful healing agent that is at our fingertips. You know, you don't need to be a medical doctor to learn about it, understand how it works in the body, you know, consult with patients, help them in their journey of discovering the best uses of cannabis for their situation. But it's also for patients. So I want patients to understand that there are alternatives. And you guys are like the perfect example of both of those things. So especially you come, you know, as a nurse, Shelene, had you ever encountered cannabis as a medical alternative prior to your own discovery and pursuit of, you know?
Not on a personal level. The type of work that I do, I work in the personal injury world. I'm a medical legal consultant. So I work with people who've been injured and there's insurance claims or lawsuits involved. And so I read tons and tons and tons of medical records all over the United States and world. And so now, within the last couple of years, we're seeing more cannabis recommended or cannabis prescribed treatment in the records. So I'm becoming more familiar with it from a professional standpoint, that it's becoming more accepted in certain parts of the states. And then we also have had a personal experience as well.
Mm-hmm. What would you say if you take off your nurse's hat? What would you say to patients who are suffering with any number of conditions, or they have a loved one who's suffering with any number of conditions? What would you say to them as far as being more open-minded to look outside of the medical box that we've all been working in for decades?
You just took the words right out of my mouth. I was going to say, be open-minded to this. I've sat in on many presentations about the pros and cons of cannabis versus opioids, and the doctors or the presenters put side by side, here's all the side effects of opioids, here are the side effects of cannabis. It's blank. They're with the exception of what you said, is that you could take too much and feel it. So keep an open mind, try it. The resources are there. I think we just need to rip the label off and allow people to try it. To the medical providers, to the medical staff, I would say the same thing. Please be open-minded. We were shunned when we brought this information to traditional providers that this was actually working, and they wouldn't hear it. They oh no, no. So be open-minded about it. Do your research. Give it a try. What's the worst that's going to happen? Doesn't work.
Exactly. There really is no downside to it. With my own journey, first of all, I was desperate. I was looking for any alternative to taking the anticonvulsant. So I was looking up alternative treatments for epilepsy, for tremors, for anything related to movement disorders. Cannabis kept coming up, and I'm like, what the heck is this? And if you go on the PubMed, there are thousands of medical studies on cannabis. And I really urge anybody, whether you're a patient or a physician, to do some research. Just like you were saying, it's out there. We've just been bamboozled to think cannabis is something that it's not. The reality is it was the most widely prescribed medicine in the United States up until 1934, when they decided to ban it because certain powerful politicians had investments and things that were, in competition with hemp and with cannabis. So that's all in the history too, if anybody wants to research that.
Lumber
I won't
industry.
get on my high horse. Huh?
Lumber industry.
The lumber industry, exactly. DuPont, who came out with all of their synthetic fabrics. Hemp fabric was a competition to that. Mellon, who had investments in the new pharmaceutical industry. Andrew Mellon, who was the Secretary of the Treasury of the United States, he was behind having cannabis banned. And that's all in the history too. I don't want to get into that, but I just want to urge people, open up your mind. This isn't what we've been told it is. This is a powerful tool for healing, not only physically, but emotionally, and improving health and getting better sleep and all of the things that make our quality of life so much better. So, I wanted to give you a little time, Shelene, to talk more about your business so that people know what you do, and, anything that you want to tell them about yourself and your husband's business, whatever.
Sure. So I've been a nurse for 30 years, almost 30 years. And the majority of those years as a nurse, I have not been at the bedside. And so people say, oh, you're a nurse. What hospital do you work at? I don't. What I tell them is I am a nurse and have owned and operated my own business, our business together, for over 20 years. And the best way to describe my nursing business is I am in the medical legal world where medical and legal intersect. Someone who is injured, slip and fall, car accident, whatever the injury is, and there's an insurance claim or a lawsuit attached to that injury, they need medical care for the rest of their life as a result of that injury. Insurance companies and attorneys need medical folks like me to be able to tell them about their the client's medical condition and what their needs are and how much it's going to cost. So I am in the field of what we call personal injury medical legal consulting. The specialty practice is called life care planning. It's not end of life. That is more hospice related or elder care. Life care planning is projecting future care and cost. So then that way the insurance companies, the attorneys, or if I have to go to court and testify, the judge and jury can make educated decisions on how much money to award or to settle on. So that is our business. The name of our company is FIG, F-I-G. Our website is figeducation.com. Not only do I practice, but I also teach. So we are one of the educational providers that teaches the specialty practice in nursing. And we also offer the certification that goes with the education. So that is what I do as far as a nurse. So I work from home and own and operate my own business as a nurse.
That's fantastic.
Thank you.
With nurses getting so burned out, especially after COVID. And I think the latest statistic I read was like 58% of nurses are considering leaving the profession. And, can you blame them? Who would want to do patient care? You're exposed to toxins, you're exposed to lethal bacteria and viruses. You have backbreaking work. You have to work weekends and holidays. The list goes on, and you're under so much pressure, and you get compassion fatigue, and you get burnout, and all of these things. And with COVID, all of that really just kind of exploded. So I love hearing about other nurses who are in business for themselves, and they have kind of, again, opened up their mind and broken out of the box of traditional nursing health in the current healthcare system and provide very important services. And so kudos to you, especially having been doing it now for 20 years. That's amazing. Really.
Yeah. Thank
So
you.
good for you. Yes, I congratulate you. So is there anything else you'd like to leave with our audience of patients as well as other health providers?
Well, from patient to patient, I'd bet my life on having that as part of my healing. And if I have to, probably I will go back into the hospital at some point and have surgery. She's sneaking it in.
I know so many patients who do that.
And I think hospitals ought to consider, especially the cannabis that does help you go to sleep and get good rest. Getting good rest and waking up with more hope than you did when you couldn't sleep is a big, big difference.
Isn't it? Yeah. Mindset has such an impact. Our thoughts and our feelings and emotions have such a huge impact on our body's ability to heal or not heal.
And
So
if you get good rest, you can see tomorrow.
Yeah.
I wasn't seeing tomorrow when I was feeling as bad as I was feeling and not sleeping because I couldn't sleep at the hospital, couldn't sleep at home. And so this has made a big difference for me.
Yeah. Oh, well, I really appreciate you sharing your story. And, I know it's going to bring a lot of hope to a lot of people, and hopefully will open the eyes of some other nurses out there who really care about people and want to help them and work with them to, get through some very difficult times in, their patients' lives. So very nice. Thank you so much.
Thank you.
And so you gave us your website. Is there any other contact information? Do you want to leave an email or anything like that?
Sure, I can leave my email. It's my name, Shelene at figeducation.com, and Shelene is spelled SHELENE at figeducation.com. Feel free to send me an email, ask questions. I'll be glad to answer any of them.
That's great. And I'll put all of that also in the description underneath the video. So any nurses who are watching this who have that that desire to get out into the legal field, make sure you call Shelene. If you're interested in cannabis, make sure you call me, because we need more of both of us. So, that ends our podcast for today. And thank you so much for joining us. I hope you really enjoyed this episode, and reach out to Shelene, and we'll be seeing you in the next one.